All right, hey everybody. So my name is Ms. Nisha, and I will be walking you through the head to toe for Mod 1 clinical lab. Okay, so first things first, I am going to perform hand hygiene. Okay, my timer has started for 15 minutes. All right, as this is drying. Okay, so hand hygiene, and then I'm going to knock. Hi, may I come in? Yes, okay. Hi, Mr. Smith. My name is Nisha, and I am your student nurse today. I'm here to perform a head-to-toe assessment. Would that be okay with you? Yes? Okay. Would it also be okay if my instructor watches us today? Yes? Perfect. So patient says it is okay for my instructor to watch. Okay, so before I get started, Mr. Smith, I'm just gonna look around, make sure there's no spills, no tripping hazards, the environment is safe, there is adequate lighting to perform the head-to-toe, okay? And then today we're just doing a head to toe. I'm going to just look you over from your head all the way down to your toes, and I'll ask you a few questions in between. Are you okay with that? Yes, perfect. Okay, so before we get started, I have raised the bed to working height. Okay, I'm going to pull your curtain for privacy. Okay, and then can I just verify your name and date of birth before we get started? And I'm going to confirm that with your bracelet. Okay, so Mr. Smith, perfect. Date of birth, 1101. Awesome. Perfect, Mr. Smith. Can you also just tell me where you are today? Awesome. At Gurnick. Do you know why you're at Gurnick today? Okay. To be checked out by your doctor. Awesome. And can you tell me what time of day do you think it might be? No, can't tell me. Can you tell me what year we're in? 2026. Perfect. Okay, so my patient is alert and oriented, ×4. All right, so I'm just gonna start at your head. Actually, I'm not. I'm gonna start at your vital signs, okay? So I'm going to make sure to glove. That way, right after my vital signs, I can get right into my head to toe. All right, so Mr. Smith, I'm going to start with your blood pressure. Would this be a good arm to assess your blood pressure on? Okay, and there's no IVs. All right, no IVs or PICC lines here. Perfect. Okay, so I'm just gonna lift your arm, Mr. Smith. All right, get the cuff on you here. Okay. All right. All right, Mr. Smith. So we are going to listen to your blood pressure. Okay, making sure my stethoscope is on the diaphragm side. Okay. Do you know your normal blood pressure? Okay, about 150? Okay. Or 150 over what? Oh, all right. We're going to pump up. Okay, so my patient's blood pressure was 136 over 92. Okay. Thank you, Mr. Smith. All right, so that was your blood pressure. I'm going to borrow your finger here. Finger looks good. Okay, I'm gonna borrow your finger. Perfect. All right, and while that's registering, I'm just going to grab your temperature, okay? All right, temperature was 97 degrees Fahrenheit, and that was taking the temporal route. Pulse oximetry is 99%. Patient is on room air. Okay. Can I borrow your wrist really quick? Perfect. Okay, so I'm going to watch and time it. Okay. Perfect, Mr. Smith. Okay, respirations were 16. All right, and while I'm here, I'm just going to listen to your apical pulse, all right? So I'm going on my diaphragm side, okay? All right, so we're going to the 5th intercostal space, mid-clavicular line. So here, mid-clavicular is here. Okay, and I'm going to count this for 1 full minute. All right, after 1 full minute, I got 86 beats per minute. S1 and S2 were heard upon auscultation. Okay. All right, and then on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain imaginable, what is your pain like today? 0? Okay, my patient reports 0 pain. All right, now Mr. Smith, I'm just going to get started. Okay, and I'm going to start from your head and work my way down. Okay, so I'm just going to look at your hair. All right, so no signs of cuts, abrasions, lesions, no scabs, no signs of lice infestation. Hair looks healthy and well maintained. All right, Mr. Smith, next I'm going to use my light and I'm just going to look in your eyes, okay? If you could look forward for me. All right. Perfect. And then one more time. All right, perfect. So can I just pull down on your lower lids? Yes. All right, perfect. Okay, and then one more thing. Can you follow the tip of my pin with just your eyes? Try not to move your head, okay? Perfect. And one more, in and out. All right, perfect. So my patient's pupils appear to be equal, round, reactive to light and accommodation. Sclera is white, cornea is clear, conjunctival sacs are pink and moist. Okay. All right. Next, I'm going to look in your nose. If you could just look up for me. Perfect. All right. Nostrils are pink and moist. There's no signs of deviation, no signs of obstruction. Also, my patient has no NG tube or nasal cannulas for breathing. Okay. Now, Mr. Smith, I'm actually going to bring you down just a little. Measure up higher than I can see. All right. Now, can you say "ah" really big for me? Perfect. All right. So my patient's gums are pink and healthy. No signs of bleeding. He is missing the 2 front teeth. His tongue is pink and moist and symmetrical. No slough on the tongue. Okay. And overall, mucous membranes are pink and moist. Okay. All right, Mr. Smith. I'm also going to check your ears. Okay. So can I just look in your ears? All right, and behind it. Okay. So looking in the ears, there's no signs of excessive cerumen. There's no skin breakdown in the ears. Okay. Thank you, Mr. Smith, for that. All right. Now, if I could have you tilt your chin down to your chest. Perfect. Can you look all the way up for me? Awesome. Can you turn to me? Perfect. And can you look to the wall there? Awesome. So my patient has full range of motion of the head and neck. All right, Mr. Smith, next I'm just going to come down here. Okay. I'm just going to feel and palpate. All right, and I'm going to borrow both arms. All right, so Mr. Smith is an amputee on the left side. Okay, so extremity is warm to the touch. So is the other side, the left side. Okay, there's also no signs of lesions, rashes, abrasions, cuts. Skin looks well maintained and appropriate for color. Again, he does have an amputation on the left side. So we'll document that. Okay, Mr. Smith, I'm just going to come down and check your capillary refills. Okay, so capillary refills on the right hand are less than 3 seconds. Nails look healthy and well maintained. Okay, can I have you just push against my hand as hard as you can? Perfect. All right, now can you pull my hand to you? Awesome. And then can you squeeze my fingers really tight? Perfect. All right, so my patient's extremity strength on the right side is strong, left side is amputated. Okay. All right, Mr. Smith, next I'm just going to look at your chest. Okay, chest looks symmetrical. There's an even rise and fall when he breathes. No difficulties are seen. Patient is also not using any accessory muscles to assist in his breathing. Okay, so now looking at that, abdomen also looks symmetrical here. Mr. Smith, while I'm here, I'm just going to listen to your lung sounds. Okay, and we're going to listen to 8 spots in the front and then 10 in the back later on. Okay, so if you could just take deep breaths for me. Okay, perfect. All right. Okay. Where we at? All right. That was my 3rd spot, listening to in and out. 4. Okay. Again, please. 5, 6. Okay. 7. Listening to inhalation, exhalation. And 8. Inhalation, exhalation. All right. Awesome. Lung sound clear. No signs of adventitious lung sounds. Okay. Now I'm going to come down to your abdomen. Just looking at the abdomen, there's no signs of ostomies or any G-tubes. Abdomen looks flat, non-distended. Okay, so I'm going to again listen, and this is on my diaphragm side, sorry. Okay, so I looked at it, I inspected it. Now I'm going to listen, starting in the lower right quadrant, working my way around. So lower right, upper right, upper left, and I do hear a sound, lower left. Okay, vowel sounds are active and present in all 4 quadrants. Okay, now I'm just going to gently press on your abdomen. Are you okay with that? Perfect. So gently pressing. Okay. All right, are you having any pain or discomfort? No? All right. Also, when assessing the abdomen, again, it was symmetrical. There were no signs of any ostomies or G-tubes. There was also no presence of distension. No masses, no lumps were felt when palpating. Okay? And patient said no tenderness. Mr. Smith, I also forgot to listen, so I'm going to go back for just a second and listen. And I'm going to listen on my bell side to your heart valves. Okay? So starting on the right side at the 2nd intercostal space, I'm going to listen to your aortic valve. Okay. Perfect. Then we're going to move over to your 2nd intercostal space, left sternal border, to the pulmonic valve. Okay. All right. Then we're going to go down to the 4th intercostal space, left sternal border, and this is your tricuspid valve. And we saw the sternal border. All right. Then we're going down one more to the 5th intercostal space, mid-clavicular line, and I'm going to listen to your mitral valve. Okay, all valves were heard and present. All right, and again, lung sounds were clear, no adventitious lung sounds were heard. Valve sounds were heard, they are active ×4. Okay, while I'm here, Mr. Smith, can I ask, when was the last time that you had a bowel movement? When was the last time you had to poop, or that you went poop? Today? Awesome. Do you remember the color? Brown? Perfect. And was it soft, hard? Soft. Okay, perfect. Did you have any difficulty going, or did you have to push it at all? No? Okay, awesome. What about the last time you had to void or pee? Okay, so the last time you peed was this morning as well? Awesome. Do you remember the color? Light yellow. Perfect. Did you have any odor? No? Any burning? No. Okay, perfect. So yellow this morning. Perfect. All right. Would it be okay if I inspect your peri area? If I could just look here? No? Okay, so my patient is refusing, but if I were to look at the peri area in the front, I would be assessing for any rash, lesions, any redness, any swelling or discharge, okay, any foul smelling odor. Can I check your bottom at all? No? Okay, so if I were to check his bottom, I would be looking for any redness, rash, hemorrhoids, skin breakdown there as well. Okay. All right, Mr. Smith, I'm just gonna move your cover slightly down. Okay. Expose your feet here. All right, now I'm just going to palpate. We're gonna feel the legs. Temperature of the skin is warm to the touch. No signs of rashes, scarring, lesions, abrasions. Okay. Looking at them, they look good. Okay, there's no signs of edema to the lower extremities. All right, can I just have you push against my hand? 1 second. All right, Mr. Smith, can you push against my hands with your feet? Push like you're pressing a gas pedal. Perfect. Can you pull your toes to your head? Awesome. Can you push your legs out against my hands? Push them to my hands. Perfect. And then can you squeeze them into my hands? Awesome. Patient's lower extremity strength is strong bilaterally. Upper extremity strength was strong bilaterally as well. Okay. And now I'm looking at your capillary fills on each toe. They are all less than 3 seconds. Toenails look healthy and well maintained. Okay. And then can I check your pedal pulses? All right, pedal pulses are +3 bilaterally. All right, so we did here. Okay. I'm going to change my gloves. Okay, there is something I forgot to assist. All right. So I did forget to assess your radial pulses, so we're gonna grab those right now. All right, so radial pulse on the right extremity is strong, +3. Okay, so we got strength, we got that. All right, also on the feet, on the legs. So for my patient's legs, I am going to assess for DVT. So feeling under the calf, can you press your foot down like you're pressing a gas pedal? Perfect, and then pull it towards your head again. Awesome, did you experience any pain there? No? Okay, let's try this one. Can you push down like you're on the gas pedal? Pull your foot to your head. Perfect. Any pain there? No. Okay, so my patient is complaining of no pain when flexing the toes, and when palpating the calves, there's no signs of tenderness, redness, or hardened areas. Patient is negative for DVT or deep vein thrombosis. Okay. All right, Mr. Smith, I am going to change my gloves again. All right, I'm out of gloves, but for the sake of this video, I have new gloves on, okay? All right, Mr. Smith, can I just have you sit up for me? I'm gonna listen to and inspect your back. Okay, so we're gonna sit up. Yes, I can assist you with that, except Mr. Smith is really heavy. All right, so listening here. Okay, just take deep breaths for me. Okay, deep breaths again. Perfect. All right, Mr. Smith. Listening to your lung sounds posteriorly, they are clear. No signs of adventitious lung sounds were heard. Also inspecting the back, I saw no edema to the sacral area, no swelling, no skin breakdown, no redness. Okay. All right, Mr. Smith. So overall, my patient appears happy and healthy. He was alert and oriented. He tolerated the assessment well. He has no IVs, no nasal cannula, no NG, no G tubes. Yeah, and this concludes my head to toe. All right, Mr. Smith, do you have any other questions for me or any questions? No? All right. So I'm going to lower the bed back down and return Mr. Smith his call light and make sure he's comfortable. And your call light is right here in reach on your pillow, Mr. Smith. Okay. Can I get you anything else? No? Perfect. All right, so bed back down to lowest height, and then I'm going to perform hand hygiene again. All right, and then I will document this head to toe, and this completes my head to toe.